Hello, everyone. My name is Dr. Olena Ayofe. I am specialist obstetrician and gynecologist from Dubai, Dr. Rami Hamed Center. And today I'm going to present you our new Well Woman Check-up program. So let's start. Well Woman Check-up program. We are really proud that we launched this program, which is created and implemented by American WPSI Women's Preventive Services Initiative. This program was designed especially to meet each woman age-related needs. Today, I will tell you about the program itself. I will explain what is WPSI itself means, and I will tell you how our program works and why it is unique and how it works, and I will answer your questions. So WPSI, Women's Preventive Services Initiative, it's a coalition of 21 healthcare organizations and patient representatives. The Women Checkup Program, Well Women Checkup Program, was developed by WPSI in collaboration with American Preventive Task Force and American College of Obstetrician and Gynecologists. And it took them 5 hard-working years to create and to implement this program. What is unique about this program? It is really a revolutionary program. It gives us tools to check the woman's health condition and to create for her individual preventive care plan based on her age, based on her current diseases and other risk factors, previous risk factors and family risk factors. The second unique feature of the new program is that it is created based on the latest, like never before, available evidence and clinical expertise. And we are proud that we keep in touch and we keep up with the advanced, world-famous women's health organizations. How the program works? First of all, we screen women for some hidden disease. Screening means to identify something which is not obvious, which is covered. And if some abnormalities found, we either give them treatment or give advice to prevent the disease, of course, if it is on the preventable stage. If the woman has already some diseases, some known conditions, we help them to stabilize the condition and to prevent the complications or to prevent the recurrence of the disease. We also discuss, and it is very important, and analyze the issues related to certain age. The program divided our women into 5 age-related groups: 21-39, 40-54, 55-65, 65-75, and above 75. For example, with a woman of 26 years old, we will discuss all the issues related to prevention, sexually transmitted diseases, contraception options, for example, if she is not planning pregnancy, or we will prepare her for the pregnancy if she is planning to get pregnant. Another example of individual approach, age-related approach. We'll discuss, for example, if the woman has diabetes mellitus, we advise her 3-6 months in advance before getting pregnant. She will be strongly advised, number 1, to change her medication from teratogenic, which are unsafe for baby to those which are safe during pregnancy. Number 2, we'll advise her to keep her sugar level as normal as possible and to take folic acid not 400 microgram as usual, as average woman takes, but 5 milligram. Another example with a woman of 55 years old, we'll discuss, of course, apart from her condition, her health-related issues, we'll discuss the possible consequences of menopause, possible urinary incontinence, dryness, mood swings, depression, fatigue, osteoporosis, prevention, and others. We also calculate the risks of developing some diseases. For example, if, based on risk calculator, the risk of developing breast cancer is low, the woman will be advised to have mammography as a screening tool. But if the risk of developing breast cancer is high, the woman will be advised to have breast cancer screening not with mammography, but with MRI and genetic testing. Mental health nowadays is very important, and we screen our patients, of course, if they wish, for anxiety, depression, for intimate partner violence, and for female sexual dysfunction, using specially designed questionnaires. We score the severity of the problem, and based on these scoring results, we suggest the measures. Which tools we have for all this service? Of course, we use history taking, collecting the information, we perform clinical examination, we do laboratory testing, imaging techniques, we have ultrasonography, MRI, mammography, CT scan, bone density scan, urine flowmetry. Everything is available in our center. We use, and this is new, questionnaires about depression, anxiety, domestic violence, general health, and sexual dysfunction. We also use, and this is also new, we use risk calculators, cardiovascular disease risk calculator, breast cancer risk calculator, bone fracture risk calculator, and others. We also use as a tool counseling. It is a very powerful tool to help patients not only to understand their condition, but to take measures to prevent some diseases and to improve their health. And of course, we do immunization according to calendar. To summarize, we offer our women a program that is based on the latest available scientific evidence. And this is also new. We create the preventive care plan really individually, based on age, health condition, and risk factors. We offer measures to improve wellness and health by means that are within every woman's control. We all know that even small steps can make big difference. We offer preventive care for women across their lifespan. And preventive care visits provide an excellent opportunity for every woman who cares about health. In the end, I just want to emphasize our slogan: when women are healthy, communities thrive. It's true, absolutely true. Communities go into prosperity. And now I will answer some questions which we had from our patients, either through online chat or via telephone. So the most important question, of course, what is the difference between previous Well Women packages and new ones? Previous packages, they were based on the amount of investigation. For example, we had silver, golden, diamond, and platinum. Silver package included the list of examination which are basic, and the highest included so many investigation and imaging techniques, and they were sometimes really unnecessary because it was illogical. Actually, they depended mainly on the patient's wallet, but those which contained the huge list of investigation sometimes were unnecessary for young people and vice versa. For example, 30 years woman, if she wants to go to proceed for the diamond or premium package, she didn't need actually some investigations like bone density scan or some lab tests, blood tests, which were obviously and will be obviously normal, and they always obviously normal. So this is the main difference. The new Well Woman Checkup program is designed exclusively according to the age interest, age concerns, and of course, plus individual concerns and risk factors. Plus, the previous packages, they didn't include questionnaires, they didn't include the risk calculators, and they didn't include the big summary with analysis, with report, and with preventive care plan. This is totally new. And of course, it was just routine list of examination. This new Well Woman Checkup program is designed on latest evidence-based researches. And once again, it took the developer 5 years, 5 hard-working years to create this program. So it's really a good and advanced program. How many times it needs to visit the clinic for Well Woman Checkup? Usually it takes 2, sometimes 3 times to visit. I will explain how it works. During the first visit, doctor is collecting some information, takes history from the patient, performs clinical examination, prescribe some tests according to the package, and which is based on age, plus according to individual needs. And in the end of all this visit, doctor gives the patient several questionnaires to fill in this form to answer the questions. And it will take usually 10-15 additional minutes from the patient to fill this form and to answer the questions. After that, patient goes home. Our woman goes home. Within next coming week, doctor analyzes the questionnaire, analyzes the reports, and once it is ready, he creates the report itself and creates the preventive care plan. During the second visit, doctor presents the report, explain and counseling our woman, and present and gives her preventive care plan. After that, our woman, she receives this big preventive care plan via email. This is how it works. Why I mentioned sometimes 3 times needs to visit, this is because maybe needs additional examination, only then it will take 3 visits. Usually it's 2 times, it's enough. If I have a hysterectomy, do I still need Well Woman Checkup? If you have hysterectomy, you still have vagina, you still have breasts, you still have urine bladder, you have some, you need some blood tests, you have your bones, you have your body, should be assessed and examined. So of course, doesn't matter whether you have uterus or you don't have uterus, you have ovaries or you don't have. Of course, it is strongly advised to visit a gynecologist annually. I heard that pap test should be done every 3 years. Why should I visit a gynecologist every year? Yeah, this is common misunderstanding now because new guidelines changed the approach. Previously, the pap test to be done every year, now every 3 years, provided, of course, that the last one was normal. And some women, they concluded that since pap test every year to be done, then no need to come to gynecologist every year. This is common mistake. Doesn't matter whether you need pap test or not. Actually, gynae visit, gynae examination, and woman checkup doesn't mean at all pap test, because so many women, they think that gynae visit means pap test. No, as I mentioned, it's really big program for assessment and examination and discussion and for evaluation. So you should come for gynecologist every year. Doctor will examine you. Doctor will, even if no need pap test, doctor will do visual inspection of your cervix. Doctor will do gynecological examination. Doctor will do clinical examination of your breast, and doctor will discuss all the issues related to your health condition. Maybe new risk factors appeared, and give you advice after all this assessment. So in the end, I want again to emphasize that we are proud that we belong to that advanced family, that we follow the recommendations by advanced American women's health organizations, and we are happy to meet you in our center, Dr. Rami Hamed Center, in our Well Woman Clinic, and you can find our contacts on our website, on our page, Well Woman Clinic. You can find also the links below this video, and see you soon in our Well Woman Clinic, in our Dr. Rami Hamed Center, Dubai Healthcare City.